Everybody, welcome to Magnificent Friday. As Janet pointed out, the weather is beautiful and hopefully will stay this way for as long as possible. Okay, so there's a lot to cover today. Let's start with the COVID and we'll see how we get through things. So the new vaccine is out. I know some of you already got it. Congratulations. They came up with the vaccine faster than we expected. It was actually available third week of August, which is good. So I know some of you got it back then. Otherwise, if I was telling you to wait until the fall when the new vaccine comes out, go get it. So now let's talk about specifics of those. So the same as before, you got Pfizer, Moderna, and Novavax. Why I do not recommend Novavax at the moment. First of all, it's the same old shot. They're claiming that Novavax updated to include Omicron. It does include Omicron, but it doesn't include new strains, the recent ones. They're claiming that because those are the strains that come from original Omicron that they should cover. I don't buy this, not even for a second, unless they show indeed in a clinical trial that their old vaccine will work, especially given that you have a choice of mRNA. I'm not a conspiracy theorist. I don't think that somehow mRNA vaccine is going to be 10 times riskier. We haven't seen any of that on paper or in any. I think every vaccine has small amount of risks, but not necessarily that mRNA is riskier than Novavax. So due to that, I don't recommend Novavax at the moment. Unless for whatever reason you feel you had a strong allergic reaction previously to any mRNA component of the vaccine or to any of the mRNA vaccines. In that case, Novavax is for you. The question is, should you wait longer to wait for the Novavax to be updated? No, they said specifically they're not planning on. They said they have included Omicron variant into the Novavax, and that's it. So that leaves you with what I just said. If you don't have a prior reaction to Novavax, get Pfizer or Moderna, your choice. Anecdotally, I have heard from several of my patients that they've had less side effects from this last booster than from the ones before. It's not clear to me why. I tried to figure out if the new boosters have different concentrations or anything. I haven't gotten that far yet, so I will probably do that. But so I'm going to open this up even before we move to the next section. And if you feel comfortable saying what was your experience if you had a shot, by all means, go ahead, either share it in the text, in the chat, or raise your hand, or just simply unmute and tell us how you feel.
I got it in Philly and I had almost no reaction. Tiny headache the next day, maybe a little fatigue, but really almost nothing. I got Moderna.
And yet CJ says that 2 out of 3 had severe reaction from what I'm reading here. CJ says 2 days, all 3. Someone told me today that 3 people getting the new COVID shot all had 2 days of reaction, fever. So no, I have not heard that. I heard exactly the opposite. I heard that people saying that nobody had any serious reaction from any of from the new booster. Okay. So I recommend either Moderna or Pfizer. I just don't recommend Novavax until they tell us that they included the latest variant, not just Omicron, because they said they included Omicron, but Omicron was already included in the last years. So they haven't actually updated it. They say that it should be sufficient, but there's no actual truth in that statement because we know that the latest variant has been escaping the vaccine. So while I'm waiting for more questions and more comments, and you guys, I'm going to add something. So it seems like expectations for the latest booster is going to be 50% protective, similar to what was going on with the last booster from the last year. So that means that you cut down the risk of any symptomatology by about 50%, which is pretty decent. I mean, I think that's sufficient. And I agree with the CDC and with all the experts that I think the risks of vaccine are much, much lower than the risk of getting another COVID. And, everybody's getting COVID. So unless you're very young or you're very healthy and you say, screw this, I'm fatigued from all this, I'm going to get sick, I'm going to get sick. Okay, well, I'm not going to argue with you. But I do think that most people should be getting the shots. Okay. More comments in the chat. Which vaccine do you think is at least likely to cause? Yeah, I don't know if I can compare Moderna to Pfizer, the new ones. I don't think there's any data right now. So I would say I can't really answer this well. I think both are going to be relatively equal in terms of their reactions. And then in theory, Novavax, the whole point of Novavax people was that, look, this is an old style. It's not an mRNA. It's going to be safer. They were never really able to show that. I don't think that that's actually necessarily true. Big round rash in her arm. Okay, so that's an allergic reaction. Okay, so then Linda says the parents had almost no reactions. So that's as compared to the right. That's actually is more frequent what I've heard. I've now heard about a dozen times patients say zero reaction or very little compared to the prior boosters. Ashley said there was a bit of evidence that the vaccine minimized. Correct. So that is that is one of the biggest reasons why I push people, especially people who are, in my opinion, at the higher risk of getting inflammatory reactions to anything. Those are the people who should be getting more aggressive about getting shots, because the whole point is not, you're not going to die from this strain unless you're in a very specific category of risk. If you're at average risk, even if you're older, over 65, you're not going to die from it. Problem is long COVID. The key question is, do the vaccines cut the risk of long COVID? And the answer is unequivocally yes. What's not clear is what does that risk decrease truly means? And you can look at all kinds of data and you can say, look, in the past, especially with the first waves, it looks like vaccine was dramatically effective. It was cutting down risk of long COVID in half, which is massive. That's not valid data anymore. We're in a completely different age of the disease, and we don't know. I mean, it's hard to say with this new variant, but I still expect we're going to see potentially double-digit decrease in risk and relative reduction risks. It's not an absolute risk. Absolute risk reduction is going to be very hard to estimate here because we're just not going to know the numbers. The big problem here is we only can look at the kind of rough estimate out there and then come up with some relative risk reduction rates. How is it truly going to apply for the absolute risk reduction for you personally? It's going to be very challenging, but I would say it's going to be significant. I mean, what exactly it will be, we'll have to wait for many, many months to know. Okay, so in my last COVID vaccine was in June of this year, or June of last year. If it was June of last year, get it. No.
June of this year.
Yeah, that's way too soon. You're going to have to wait. Yeah, I would say 6 months from this time. I don't want people to get shots all that frequently. You know, so I think probably so early next year.
Thanks.
Was told by CVS pharmacists, but not verified, is that 2240M has Moderna and yeah. So you guys call around your pharmacies. Everybody's slightly in different places. That's my strong recommendation. Call CVS or whatever big pharmacy chain. They all seem to carry them. I have not heard any lines. I don't know if anybody's seen anything. I've heard some places claim that they have shortages, but then you call another CVS and say, we don't have any shortages. So I think it's like very specific to the area. So just call around. Yeah, so same, Yari, exactly. If you just had COVID, I'd wait. I don't see any reason why because you definitely probably had, well, scratch the probably word, sorry. You definitely had one of the new variants because that one of those K2 ones, K2.1 or whatever they are. It's simply there's nothing else at the moment. So you getting a booster now doesn't serve any purpose because this new antibodies you just generate are going to protect you for quite some time, for at least Data is unclear. It's 3 to 6 months is what would everybody say. CDC tries to push boosters in 3 months. I think they're just trying to boost it. I mean, because frankly, I think there's too much politics here. They are so behind. People have just not been accepting boosters. It's been uptake of a new boosters have been last year has been horrible. This year it's even worse. So check out Janet's hibiscus ginger beer. Telling you. Target. Oh, it's on sale at Target, doesn't it? It's only at Target. Safeway, always great. Okay, good. Oh, Safeway was probably related to the shots. Yeah, Safeway pharmacies are pretty good offer. Okay, I had a COVID for first time in June. I'm 68 this one. Okay, so you don't need a booster at the moment. So you wait until you should do what I told B. Get a shot in January. So get a shot 6 months from your illness, which is the same as when B had her vaccine. Yes, we'll talk about this. Sheila, hold your thought. I'm going to show the prep. It's part of today's conversation. Since you got me for a full hour, it will be one of the things we're going to cover in a minute. I'm just getting through an actual COVID things first. I had COVID in end of April, not clear. No, okay. Yeah, okay, so you got a booster. You just got a booster, okay. Yeah, January, same. January, February, for the next one, for this new one. If you already got your...
I just got it.
Yeah. You got the new one or the old one?
I got the new one.
Oh, so then you're all good. You're good for a while. So I would say if you got a new one, wait for next year. I mean, wait till next fall. If you didn't, I would still get a new one because the question is then, which should you if you just had a COVID, then should you wait till the January or should you wait a whole year? Yari, knowing you, I think slightly more aggressive, but I think that gets to minutia. Honestly, this is not all that easy to answer. I think it also depends on how your health generally is. If there's some kind of a dip in the health, and I potentially would say get boosted a little bit earlier. So yeah, so if you had a one in April, that would mean that in October it'll be 6 months. That's when I would get it. The problem is, though, let's switch to broader conversation about fall vaccines, which I know you guys want to ask me to talk about this. So, we basically talking about 3 vaccines. We're talking about COVID, we're talking about flu, and we're talking about RSV. There are multiple vaccines for each. RSV, there are 3 vaccines on the market. COVID, there are basically 3 vaccines on the market. And the flu, I can't keep track. Usually we have 2 to choose from in the clinic where I work, but often there are a lot more choices. So COVID and flu not changing. If you haven't had a booster for COVID, go get it. The new one is available. Get it ASAP. Don't wait for anything. 2 reasons. Number one, because you want to get a flu shot soon, but you don't want to combine them. Remember my idea, do not combine vaccines, no matter what CDC tells you. It's a common sense. You want to spread vaccines out. You don't want to overwhelm the immune system with multiple challenges simultaneously. It risks much stronger inflammatory response. There is some data that in certain subpopulations, combining vaccines increases risk of all kinds of side effects, and some of them bad side effects. We're talking about strokes. So I wouldn't do that. I think you should get a COVID now because it's just came out. It's available. COVID is on the peak at the moment. We don't expect the peak to suddenly drop out. Remember, nothing moves fast here. We're slightly beginning to drop off, at least in our area, slowly going down. I think we passed the highest peak. But we're going to be riding that peak, and who knows what happens deeper in the winter. We may have another peak on top of this summer peak. So we may end up having, instead of a big dip, we may not have a big dip compared to last year. We'll just cruise right into the next peak. So get it now. And then get your flu shot sometime in late September, or maybe even early to mid or late October. Typically, flu doesn't come in the first cases until sometime in October. So you would be safe not to get any shots for at least 3 weeks from now until the 1st of October. That's my general statement. Now, RSV vaccine is more challenging. we talked a lot about this in the past. I still generally sort of more skeptical about RSV than about other shots because the data is not all that great. There's just not a lot of it. The data seems to be overly simplified. They scaring people with RSV, and in reality, only really immune compromised people with RSV are at the true risk. Blank statement that everybody over 65 is a dramatically increased risk of death is wrong, completely wrong, because there are 65, 75, 85, 95, 105, and there is 65 and 65. Right? There's 65 elite athlete running marathons, and there's 65 cancer patient in stage 4 on chemotherapy. You can't compare those two patients, right? So the reality is, unfortunately, I'm gonna not discuss RSV vaccine any further. I'm a lot more skeptical about it. I do recommend it to only a couple of categories of patients routinely. Patients with asthma and COPD who are not doing well controlling their illnesses, meaning they have a lot of symptoms of asthma and COPD. That's one category because they're much higher risk of any pulmonary problems in the first place. And then patients with severely immune compromised. So I just mentioned somebody who has a cancer and going through the treatment, chemotherapy, radiation. So those I would consider severely compromised. You have a stage, if you're cancer survivor, if you have a cancer, but you're not, you're on active surveillance, like early prostate cancer or something. No, you don't qualify. I mean, that's a different category. Your immune system is close to normal, so I wouldn't do that. Okay, are we not masking anymore? Well, yeah, that seems like exactly. Thanks for a good observation. I mean, you don't need to be a genius to kind of walk in everywhere and nobody masking anywhere, which I find a little problematic. Let me ask this. I mean, you're all traveling. Those of you who've been traveling, have you observed other countries masking? Yeah, I know what the answer is, but I want somebody to say it who actually traveled. Nobody masking anywhere. That's what I'm hearing. I'm hearing that wherever you go, nobody uses masks anywhere. I think that there's nothing wrong with wearing a mask in a store. I don't, mostly because I feel strongly that typically it's just not enough risk for me to worry about. But if I'm on a public transportation for more than 5 minutes, I am masking. I see a hand. Sheila, do you want to say something?
Yeah, I want to say, you know, I see I got COVID 3 times and everybody's getting it. Isn't it partially because of no one's masking?
Correct. Yeah, I mean, that's the whole point why we're having a wave, because nobody's masking. People are very fatigued. They don't want to deal with this. They don't want to think about it. They don't want to go get vaccinated. And they often don't care. I've heard even worse stories. I've heard people like, yeah, my friend had COVID. We went dancing. Now I have symptoms, but I'm not going to test because I don't really care. I'm going to get better in a couple of days. And I'm like, yeah, but like, don't you care about infecting your friends and family? They're like, no, not really. I don't really care. I'm like, oh boy, okay. Like, you know, this is the point of that deep fatigue that people kind of like, they don't even want to know anymore. It's just the people like, oh, it's just the cold. The problem, though, this is the important one. It's not just the cold. That's the people. We can't forget the fact that long COVID risks are absolutely real. Our long COVID program is like there's no tomorrow. I mean, we have submissions 2 to 3 to 4 patients every week joining the program because there is a lot. I mean, it's not, the numbers are not improving. Still, anywhere from 5 to 10% of everybody who contracts COVID gonna end up with long COVID. You know what that means? That if we're all gonna get COVID continuously every couple of years, we're all gonna end up having long COVID at some point. You know, hopefully most of us will recover from long COVID, but there's an exceeding concern. And I've read some insane statistics showing that there's some prediction of loss of horrendous amount of productivity and an unbelievable financial burden to society from lost productivity. Still, have you heard any of our presidential candidates mentioning, forget discussing, mentioning this topic, not even once. Nobody wants to deal with this. It's an elephant in the room. They don't want to talk about, they don't have treatments, they don't care. Now insurances are beginning to not cover treatments for patients. We've been hearing that. So things are not getting any better.
But, back to the masking, it seems so simple to put a mask on, at least sometimes. Like, for example, I went to the show at the National Theater, and I got a seat at the end. I'm really particular where I get seats. And I had my mask on, we're cheek to cheek in these places. Nobody else had a mask. There were like 2 or 3 people, that was it. The rest of everybody was close up, and so my thinking is that there doesn't seem to be any analytical thinking in any areas and places where you're going, where people say, oh, I'm in a big crowd, let me put a mask on. I'm in a theater, let me put a mask on. I'm on a bus, like you're saying, a bus, let me put my mask on. Now, of course, it's everybody thinking this on their own. You have to kind of just decide for yourself nowadays how much you're gonna do or not do. But it seems like people aren't even deciding to do any of this stuff. So I'm just can't understand how.
Well, everybody read Elle's comment.
And nobody's doing anything now. So so you could see.
Think about it this way. It's not just COVID. Every respiratory illness, the masks will decrease risk of, like, universally, right? I mean, that's not like 37,000 deaths from flu every year can be saved, and so many things can be saved. I mean, there is an idea that in some countries, like in China, for example, nobody would say a word. I mean, something like 20 to 30% of everybody in public transportation wear masks in some countries, irregardless what the state of anything is, just because they don't want to get it. And I think it's a completely reasonable approach, and unfortunately, it's a societal issue. Nobody cares about this topic in China. You want to wear a mask, okay? And somehow putting mask in this society feels like we're violating somebody else's something. It's a hypocrisy. Like the New York, actually, remember I mentioned that New York actually, not the New York City, but New York State passed a law that basically prohibits you to wear a mask in public, including public transportation. They did pass that law. Now, nobody's going to enforce it. It's just a paper law. Well, how are they going to enforce it? And I can imagine what will happen if somebody will get some consequences. They're going to sue the ass out of the state, and correctly so, and probably going to win tremendous amount of money if they can basically say, look, I'm at health risk. I'm putting a mask on. You can't mandate me to disprotect myself from somebody else's illness. That's as insane as it could get on a level of litigation. But the reality is these things are read by a society as, we don't want masks. We're invincible. We're not going to get long COVID. And the practice shows, well, too bad. So, okay, I want to address Elisa's point about shingles. So shingles is actually a very good vaccine. We particularly talk about only one vaccine. You only want to remember one word, which I'm putting in a chart, and that is Shingrix. You don't want to get any other shingle vaccines because there is other ones, which I don't even want to name so that you don't get confused. And the problem is the older ones were not very effective. They were there, but they were not very protective. Shingrix is. So now here comes the question. If you're over 60 or even over 55, it's a good vaccine to get for most people. But if you're scared about the vaccine, here's what I recommend to everybody. Check your level of your antibodies. It's very easy to do. Ask your doctor to run the level. If your level is very high, like above detectable, or just high, like you compare it to the range and it's all the way on the right side, it's probably not as critical. But if you checked and you low or non-existent, no antibody, well, of course, go get it, because it means you're completely not protected or your protection is very weak. That's one way to try to risk stratify yourself personally. Unfortunately, there's no other easy ways. If you never had shingles, it doesn't mean that the first episode of shingles is not going to be devastating, causing severe neuralgia after, and the shot is actually the best way to prevent that. that's in some way, why do I not push shingles on everybody? It's not going to kill you. In the worst case scenario, you're going to get this chronic pain afterwards, which there are methods to treat. It's not an illness that, in essence, life threatening. I will tell you a couple other things. Generally speaking, people who have a severe postherpetic neuralgia always had something else going on with them. That is my side note for you guys. It's a unique statement. You're not going to hear it anywhere else but here in this meeting. And most of those patients had a mercury toxicity in my practice, to the point where I even published a specific case of that. And if anybody's interested, message me, I'll send you the publication. So we've seen that. We've seen that before, when patients would start having some kind of neuropathic pain out of blue or after the shingles, and then we would diagnose it as an underlying, there's something toxic. So just wanted to put it up there. Yeah, so that's Jennifer. It's the same thing. It doesn't matter, because your chicken pox as a kid, that immunity may be all gone by now. So the thinking goes that, yes, the chicken pox protection is longer lasting, supposed to be most of your life. But the data is very clear. Despite all that, if you get a Shingrix vaccine, the risk of the post-herpetic neuralgia, that's the term for this chronic pain, significantly goes down. That's the only thing that Shingrix actually do. There's no change in mortality. There's no change even in general quality of life, believe it or not, because the cases of severe post-herpetic neuralgia are just not all that common. You just don't want to be one ending up with it. That's the problem. Like, if the risk, let's say 1 in 100, that seems like a small risk until you are 1 out of 100. That's the part of it. All right, US. Okay, perfect. So thank you. Somebody just beat me to this. I was just going to talk about the upcoming changes. Who beat me? Jacqueline. Very nice. Very sweet. All right, so next big topic. The free tests are coming. Thank God. I was convinced that we were done, but apparently government is realizing, wait a second, it's not all that great yet, so let's give it a... So starting in late September, we will have 4 kits. Keep an eye on this website. I'm going to remind everybody whenever I'm around and whenever I'm leading. The moment that it's open, just type in your address. Remember, it's 1 per household, not 1 per name. So if you try to put the same address under 2 different people, there's a way to do it. You have to be Russian to figure out how to do it. But I'll give you a secret, so you can all be Russians for Friday. You just say there's 2 apartments in the same house. The mailman's not going to say anything. They're just going to drop it off at your house. That's what I do. So I just, this way I get 8 kits. So I put 2 different names and I say that, this is, me and my wife, and there's apartment 1 and apartment 2. Seems to work. So you guys decide how many kits you truly need. Now, it's not clear how often you can order it. They don't say it yet. I was just on that website and they don't say, they just say 4 kits free. Now, that doesn't mean that, I think in the past they were giving 4 kits every 6 months, if I'm not mistaken. So I don't know if they will change that. But that's a good news, because you want to have kits at home all the time, right? Quick reminder, don't throw out expired kits. Most of them are fine. They're especially good to use first time. Like, let's say you've got symptoms and you're very concerned. Run the expired test first. If your control is working, the test is fine. You can rely on that. And then you can, if the symptoms continue, I probably then run the non-expired test next day or half a day later or something like that. All right, so I have some other updates. We're at 2:33. Let's take another 10 minutes or 7 minutes or something like that. And we'll switch to MindBody. So you've seen more damage from the shingles. I have not seen all that much problems with the shot. I think the risk of rare complications, something like Guillain-Barré syndrome, which is a ascending paralysis from the shingles shot, is real. It's a real risk, but it's something like, if I'm not mistaken, 1 in 10,000. That's a very low risk. But the risk of severe postherpetic neuralgia is somewhere between 1 to 5%, depending on the study you're looking at. That's not a trivial risk. The problem with this condition, in the standard of care, there is no treatment. The treatment for postherpetic neuralgia are this gabapentinoid drugs, which are awful. They cause universal side effects. Every single patient take them will have those side effects. The low doses will have those side effects very small, barely noticeable. The higher the dose, the more noticeable the side effects, but they're 100%, they're universal. Everybody who takes them will feel some difference. You know, they're not going to kill you, but they're going to cause brain fog, fatigue, kind of memory lapses. They're not a happy drugs, you know, they're not, and they're kind of numbing. So the drugs are used, the same drugs used for falling asleep in people with severe insomnia off-label. They used for adjunctive seizures to kind of control neuroexcitation. You know, they used for sometimes for bipolar disease. They used for condition where the central nervous system is overexcited. You don't want those drugs. You need your nervous system to be excited. You don't want it to suppress your excitement of living your life. Let's put it this way. So, and you know, yes, acupuncture we've seen work quite sometimes successfully for postherpetic neuralgia, but it's not a happy condition. People who get it severe can suffer for months, if not years, with it. So I just want to leave it at that. Okay, so a couple more things. First of all, since the test got covered, which is very, very nice. Let me put you, remember last time we talked about magnesium, so I finally got myself to record a longer video with all the links to all the things, in all the creams and everything. So here's the link, and I'm just going to leave it at that. By all means, feel free to check it out. I covered, the whole video is about 20 some minutes. So it's a bit longer than what I discussed. So I included a couple more details there. Like I included why I like particularly this cream, this topical magnesium versus that one. So you may find more details there if you're interested. So that's one. The second, we just recorded first portion of Planetary Health. Those of you who've been with me for a while know that I'm increasingly worried about the effects of climate and effects of our planetary health, not just on our own health, but just on the health of the entire planet, all the species. So this is a little bit of us getting into the momentum of trying to say it's not enough for us to treat our patients. We want our patients to also be treated in the context of planetary health. So as you may have heard, we have chosen to hire planetary health director for the clinic. Which is Jennifer Rue, who is also a Ayurvedic practitioner. So please check that out. That's the first portion. It's a little bit heavy on didactic. It's kind of more like a lecture for 40 minutes, for 30 some minutes with Dr. Rue. But then after we have a dialogue of back and forth of different issues, we're going to do a second portion. When you go to this video, if you're interested in this topic, check it out, because Dr. Rue is going to start doing what we call a planetary cafes, which are this series of events where you just talk. I think the problem with this subject, we all feel we have no control over what's happening on a global scheme, right? We feel like, well, we can control our own garbage. We can control. I'm putting solar. Guys were banging on my roof today. They were measuring. So we're putting solar panels on our roof. Like you can do certain things like this, but it feels like overwhelmingly not enough, right? It feels like, well, that's just little pieces. That's true. But at the same time, the biggest and the most important point, I believe, is for us to increasingly get educated, is for us to get increasingly more sophisticated instead of pushing back on the ignorance and on people saying there is no climate change, we're perfectly fine and whatever. Instead of just saying you're full of it, you have no idea. No, just, you don't have to, you can be an educator. You can learn to have facts at your disposal. You can get into the minutia of it. You can say, look, you know, here's the rise of the North in Carolinas. This is what's happening with the shore. It's rising this way. It's affecting the local jurisdictions this way. This is how much money they're losing per year because they constantly have to invest into updating the shoreline and protecting more. And so consequently, the snowballing effect is going to probably look like this, and this is what we're going. And and every scientist say that the rate of the warming, global warming, is increasing at more than expected range. The consequences of this generally more. So we probably constantly looking at the best case scenario, not realizing that the worst case scenario is probably a whole lot more catastrophic, and without trying to scare anybody. Because one of my problem with this topic is, it reminds me of my feeling towards the war in Ukraine. It's the sense of, I can't deal with this anymore. It's the sense of overwhelm. Like I'm emotionally detaching myself because I don't know how to handle this. So we have to be smarter than that. We have to get over that and say, well, if we all feel that way, we're all going to keep on following the trajectory we're on. But the only way to get out of this is to say, no, we have to get emotionally to the point where we feel like we're going to take action. No matter how small that action feels. Okay, I'm putting solar on. That's an action. You can, no matter how you feel about this, you can just decrease certain things you're doing that are negatively, and you can compost more. You can buy things that have less package. I mean, you can free cycle more, right? So there are things that, but it's individual decisions of where you're going to put your energy and how you're going to think about this. We also, my wife and I are also in a situation where we obviously have to sort of push our kids into thinking. That has been very challenging. I mean, we are running with the sticks and carrots after them for every piece not being recycled. And it's they probably fed up with us more than we want. But the reality is they are the ones that are going to inherit this. And if we don't get them at least think about this topic, who else will, right? I mean, so it would be way worse if they somehow catastrophically getting into that because some climate episode have done something to them, like the tree fell in the car and now they're suddenly thinking about it, right? It'd be a lot better to think about this before you have cataclysmic event. All right, so I think I talked about this a bit too long, but actually it's 2:41. I think I'm good. All right, well, with those, the next week, we're recording a very interesting talk on lectins. Some of you may be very interested in this. So lectins is a group of nutrients that are very controversial. If you listen to Andrew Weil, he said there's no problem with lectins, eat as many as you want, but a lot of people disagree with that. Some people feel that lectin-low, lectin-free diets are part of their recovery. So we'll be hearing all about it. I think we'll record it next week, and then we'll probably put it out there in a week or two after. So with that, let's get down from our heads into our bodies. So what I invite you to do is to, for this practice we're going to do, feel free to go lay down. Totally fine. If you fall asleep during this, I'd be happy camper. There's nothing wrong with this. We're going to do a practice that is a little bit a brainy practice, if you will. And I'm also recognizing that I may, some of the aspect, the practice is going to list religion in a certain way. It's going to mention that there is one religion and includes all religions. So if you disagree with this, please just flow with the practice. It doesn't mean to upset anybody. It's just the way the wording here is framed. So it's a 10 Sufi Thoughts practice. And we're going to take about a minute per each of those 10 thoughts. And, if you guys want, what I'll do is I will send Janet the actual text of the practice at the end. So, and actually what I will also do, I'll put that in the chat. So the entire practice is there. But I'll do that after we're done, because I don't want you to read the chat while I'm talking, listening. So go ahead and get comfortable. If you're laying down, by all means, close your eyes. Fall asleep, you fall asleep, nothing wrong with that. If you're sitting down, you can close your eyes, you can keep them open. It kind of doesn't matter. You just, whatever speaks to you. If you have something that's hurting, my invitation is try to simply adjust it and see if you can get a little bit more comfortable before we begin. All right. If something doesn't strike you as an agreeing, skip this part. That's all I can say. So the thought number one, there is one God, the eternal, the only being, none exists save she. So we're going to inhale. It is God whom I see. And then we're going to exhale in all names and forms. And we're going to do this 5 times. We're going to inhale. It is God whom I see. And we're going to silently exhale in all names and forms. It is God whom I see in all names and forms. Again, inhale, it is God whom I see. Exhale in all names and forms. So now just do a couple more breaths by memory in a silence before we move to the next. Second, Sufi thought, there is one master, the guiding spirit of all souls, who constantly leads her followers toward the light. There is one master, the guiding spirit of all souls, who constantly leads her followers towards the light. We're going to inhale, teach me, O Lord, and then exhale through the words of thy messenger. You can also say, teach me, O sovereign, towards the words of thy messenger. Teach me, O sovereign, through the words of thy messenger. And then let's do a couple of silent inhale, teach me, O Lord, and exhale through the words of thy messenger. Let's move to the third. There is one holy book, the sacred manuscript of nature, the only scripture which can enlighten the reader. Again, there is one holy book, the sacred manuscript of nature, the only scripture which can enlighten the reader. Inhale, unfold thy secrets through nature. And exhale, and reveal thy mystery through my heart. Again, inhale, unfold thy secret through nature. Exhale, and reveal thy mystery through my heart. One more time. Unfold thy secret through nature, and reveal thy mystery through my heart. And now a couple of silent breaths. Good. Let's move to the fourth. There is one religion, the unswerving progress. Again, there is one religion, the unswerving progress in the right directions toward the ideal. which fulfills the life purpose of every soul. I'll read this one more time. There is one religion, the unswerving progress in the right direction towards the ideal, which fulfills the life purpose of every soul. We inhale. The true religion is the sea of truth. And exhalation. All different faiths are as its waves. Inhale. The true religion is the sea of truth. Exhale. All different faiths are as its waves. One more time. The true religion is the sea of truth. All different faiths are as its waves. A couple of silent breaths. Inhaling, the true religion is the sea of truth. Exhaling, all different faiths are as its waves. Next one. There is one law, the law of reciprocity, which can be observed by a selfless consciousness, together with a sense of awakened justice. There is one law, the law of reciprocity, which can be observed by a selfless consciousness, together with a sense of awakened justice. This is a little different. Inhale, exhale here. So there's two parts. Inhale, from whomever I take anything. Exhale, I take it from thee. To, and again, the inhale, to whomever I give anything. Exhale, I give it to thee. Again, inhale, from whoever I take anything. Exhale, I take it from thee. Inhale, to whomever I give anything. Exhale, I give it to thee. Third time. Inhale, from whoever I take anything. I take it from thee. To whomever I give anything. I give it to thee. And now, few breaths in silence. Six. There is one family, the human family, which unites the children of earth indiscriminately in the parenthood of God. Again, there is one family, the human family, which unites the children of earth indiscriminately in the parenthood of God. So we inhale, I find thy shrine, and we exhale at the heart of the human being. Again, inhale, I find thy shrine, exhale, at the heart of the human being. Again, I find thy shrine at the heart of the human being. Now silent, inhaling, I find thy shrine. Exhale at the heart of the human being. For a few breaths. Moving on to the next. There is one moral, the love which springs from self-denial and blooms into deeds of beneficence. There is one moral, the love which springs forth from self-denial and blooms into deeds of beneficence. Inhale. In showing my sympathy to anyone. Exhale. I express my love to thee. Inhale. In showing my sympathy to anyone, I express my love to thee. In showing my sympathy to anyone, I express my love to thee. Let's inhale. In showing my sympathy to anyone, exhale. I express my love to thee in silence for a few breaths. Next one. There is one object of praise, the beauty which uplifts the heart of its worshippers through all aspects from the seen to the unseen. There is one object of praise, the beauty which uplifts the heart of its worshippers through all aspects from the seen to the unseen. We inhale, I see thy beloved beauty in all colors and forms. Inhale, I see thy beloved beauty. Exhale, in all colors and forms. Again, inhale, I see thy beloved beauty in all colors and forms. And continue silently for a few breaths. Inhaling, I see thy beloved beauty. Exhaling in all colors and forms. Moving on to the next, number 9. There is one truth, the true knowledge of our being, within and without, which is the essence of all wisdom. There is one truth, the true knowledge of our being, within and without, which is the essence of all wisdom. We inhale. I let myself turn, exhale, into thy being. Inhale. I let myself turn, exhale, into thy being. One more time. In. I let myself turn out into thy being. Now, silently inhaling. I let myself turn, exhale, into thy being for a few breaths. Next one. There is one path, the annihilation of the false ego into the real, which raises the mortal to immortality, in which resides all perfection. There is one path, the annihilation of the false ego into the real, which raises the mortal to immortality, in which resides all perfection. Inhale, let me be melted into thy divine ocean, and exhale as a pearl in wine. Inhale, let me be melted in thy divine ocean. Exhale as a pearl in wine. Again, let me be melted in thy divine ocean. Exhale as a pearl in wine. Continuing, inhaling, let me be melted in thy divine ocean, and exhale as pearl in wine for a couple of breaths. Thank you, friends. Hope this was not too prescriptive. It's a lot of words here, but I think it's a pretty profound practice. Can be done daily. You don't have to do it long. You can do a couple of breaths for each. I'll make sure we'll get the text to everybody. Also, as I promised, I'm going to copy paste it here. There are some mistakes in the text which I have to correct. It didn't realize it until I was reading it. So. Oh, too long. I can't. I have to copy paste it in parts. Okay, let's try that. Still too long. Right.
Misha, where did this come from?
It's a classic Sufi practice in our order. It's considered to be open to anybody. You don't have to be anything to practice this. You don't have to have any special initiation or anything. I guess you can say this is kind of a universal truth of practice. It's often prescribed to master your own attention to the breath, if anything. I think it's also very good for when you have doubts in any particular paths, because it kind of removes a lot of barriers for understanding that truth is a lot bigger than us and a lot bigger than any one path. But you know, that may not sit with everybody very well. That's what I was trying to communicate before we started. So I kind of copy pasted things in parts. There is a mistake here, exhalation in I think number 5. It should start with inhalation and with exhalation, and then there are a couple of misspelling, like in the last one, instead of they, it's die. But again, I don't know if I can. I'm going to try to correct all of this before I send it to Jen. So I just realized, I guess somebody who typed this up was really in a rush.
Oops.
Well, I hope you liked the practice.
Thank you. That's
Yeah.
good.
Good to hear it.
Misha, do you want to mention that you do the practice on Sundays?
Sure. Every Sunday, every Sunday except the second one at 11 o'clock, we have a healing service, which is kind of, there's some similarity to this. It's a script that conductor leads, and then when script is over, before the script starts, there's a little bit of a attunement, and then when the script is over, there's also a little bit of a kind of a closing ceremony. And then we include anybody who wants to have a prayer for their health in there. So it's a direct healing service for those suffering. And then there's also a portion where we send healing energy to anybody. So I have little announcement, which I will have more in an upcoming weeks, but we just flew a shaman from Mongolia. It's a very rare Tibetan energy healer who has some really interesting results. We're going to be very careful. She can only treat 3 people per day, so it's going to be a very limited scope of what she's doing. But if you're very, very interested in this, by all means, send me a message. And when she gets more comfortable here, I'll give you more details. Have a wonderful weekend. Stay cool. Enjoy. Go exercise more outside.
And next week we will have Joelle.
And I may not be here next week. I have a meeting at the National Cancer Institute, but I'll see what I can do because so far we haven't found anything. And then I will be skipping the following. I'm taking a little break. But we'll see you all next Friday.
Thank you, Misha.
Bye.
Thank you.